Question 1. Which gland is primarily responsible for calcium regulation? A. Thyroid gland. B. Parathyroid gland. C. Pituitary gland. D. Adrenal gland. Answer: B. Parathyroid gland. Question 2. What would be the nurse's priority intervention for a patient with Addison's disease experiencing confusion and fatigue? A. Start 4 fluids with glucose and sodium. B. Administer calcium gluconate. C. Monitor hemoglobin levels. D. Apply a cardiac monitor. Answer: A. Start 4 fluids with glucose and sodium. Question 3. A patient receiving desmopressin for diabetes insipidus reports a headache and weight gain. What is the nurse's first action? A. Encourage fluid intake. B. Assess for signs of water intoxication. C. Increase the medication dose. D. Apply oxygen. Answer: B. Assess for signs of water intoxication. Question 4. Which hormone directly increases renal reabsorption of water? A. Cortisol. B. ADH. C. Aldosterone. D. Epinephrine. Answer: B. ADH. Question 5. Which symptom is most concerning in a patient with Graves' disease? A. Heat intolerance. B. Exophthalmos. C. Restlessness. D. New onset atrial fibrillation. Answer: D. New onset atrial fibrillation. Question 6. What is the most appropriate action by the nurse for a patient with a goiter and difficulty breathing? A. Notify the provider immediately. B. Offer small frequent meals. C. Instruct the patient to lie flat. D. Encourage oral fluids. Answer: A. Notify the provider immediately. Question 7. Which nursing action is appropriate to delegate to a UAP caring for a patient with SIADH? A. Weigh the patient daily. B. Educate on fluid restriction. C. Assess neurologic status. D. Monitor serum sodium. Answer: A. Weigh the patient daily. Question 8. The nurse is evaluating understanding of insulin administration. Which statement indicates a need for further teaching? A. I will rotate injection sites. B. I can mix glargine with regular insulin. C. I will check my blood sugar before injecting. D. I will inject insulin in the abdomen. Answer: B. I can mix glargine with regular insulin. Question 9. What is the function of the hormone calcitonin? A. Increases serum calcium levels. B. Enhances bone resorption. C. Decreases serum calcium levels. D. Stimulates parathyroid hormone. Answer: C. Decreases serum calcium levels. Question 10. A diabetic patient with neuropathy reports a new foot wound. What is the nurse's priority? A. Educate on proper foot care. B. Apply an antibiotic ointment. C. Assess wound size and signs of infection. D. Schedule a podiatry consult. Answer: C. Assess wound size and signs of infection. Question 11. What hormone stimulates the release of thyroid hormones from the thyroid gland? A. TSH. B. ACTH. C. FSH. D. GH. Answer: A. TSH. Question 12. A nurse is caring for a patient with acromegaly. Which finding is consistent with this diagnosis? A. Delayed puberty. B. Decreased libido. C. Enlarged hands and feet. D. Decreased appetite. Answer: C. Enlarged hands and feet. Question 13. Which endocrine gland is located in the brain and regulates circadian rhythms? A. Pituitary. B. Pineal. C. Thyroid. D. Hypothalamus. Answer: B. Pineal. Question 14. Which condition is characterized by hypersecretion of cortisol? A. Addison's disease. B. Cushing syndrome. C. Graves' disease. D. Hypoparathyroidism. Answer: B. Cushing syndrome. Question 15. Which medication is used to manage hyperthyroidism by blocking hormone synthesis? A. Levothyroxine. B. Methimazole. C. Prednisone. D. Fludrocortisone. Answer: B. Methimazole. Question 16. Which patient is at highest risk for developing type 2 diabetes? A. A 19-year-old with a BMI of 21. B. A 35-year-old with a family history and sedentary lifestyle. C. A 45-year-old marathon runner. D. A 10-year-old with low birth weight. Answer: B. A 35-year-old with a family history and sedentary lifestyle. Question 17. A patient with diabetes insipidus presents with a urine output of 400 milliliters per hour. What is the nurse's priority action? A. Document the finding. B. Notify the provider. C. Encourage fluid restriction. D. Start potassium supplementation. Answer: B. Notify the provider. Question 18. What hormone causes the liver to release stored glucose into the bloodstream? A. Insulin. B. Glucagon. C. TSH. D. Cortisol. Answer: B. Glucagon. Question 19. Which lab finding is consistent with SIADH? A. Serum sodium 128 milliequivalent/L. B. Serum osmolality 295 mosm/kg. C. Urine specific gravity 1.005. D. Blood glucose 200 milligrams per deciliter. Answer: A. Serum sodium 128 milliequivalent/L. Question 20. A nurse is monitoring a patient after thyroid surgery. Which finding requires immediate intervention? A. Hoarse voice. B. Mild neck pain. C. Tingling around the mouth. D. Sore throat. Answer: C. Tingling around the mouth. Question 21. A patient with hypoparathyroidism is at risk for which complication? A. Hyperglycemia. B. Tetany. C. Hypertension. D. Fluid retention. Answer: B. Tetany. Question 22. Which hormone promotes reabsorption of sodium and excretion of potassium in the kidneys? A. Cortisol. B. Aldosterone. C. ADH. D. Epinephrine. Answer: B. Aldosterone. Question 23. A nurse caring for a diabetic patient notes cool, clammy skin, and slurred speech. What is the priority action? A. Recheck the blood sugar in 30 minutes. B. Administer 4 fluids. C. Give 15 grams of fast-acting carbohydrates. D. Notify the healthcare provider. Answer: C. Give 15 grams of fast-acting carbohydrates. Question 24. Which gland secretes hormones directly into the hypophyseal portal system? A. Pituitary. B. Thyroid. C. Hypothalamus. D. Adrenal cortex. Answer: C. Hypothalamus. Question 25. What should the nurse monitor in a patient receiving long-term corticosteroid therapy? A. Hypoglycemia. B. Signs of infection. C. Hypotension. D. Dehydration. Answer: B. Signs of infection. Question 26. What is the primary action of insulin? A. Stimulate fat breakdown. B. Promote glycogenolysis. C. Facilitate glucose uptake into cells. D. Inhibit protein synthesis. Answer: C. Facilitate glucose uptake into cells. Question 27. Which finding in a patient with Cushing's syndrome requires immediate nursing intervention? A. Blood glucose of 130 milligrams per deciliter. B. Blood pressure 168/100 mmHg. C. New onset confusion. D. Moon face appearance. Answer: C. New onset confusion. Question 28. A nurse is delegating care for a diabetic patient. Which task is appropriate for a UAP? A. Teaching foot care. B. Administering insulin. C. Checking blood glucose with glucometer. D. Evaluating dietary compliance. Answer. C. Checking blood glucose with glucometer. Question 29. What is the function of luteinizing hormone, LH, in females? A. Stimulate milk production. B. Initiate ovulation. C. Promote uterine contractions. D. Inhibit FSH secretion. Answer. B. Initiate ovulation. Question 30. A patient has a total thyroidectomy. What electrolyte should the nurse monitor closely? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer. C. Calcium. Question 31. A nurse notes trousseau sign in a post-op thyroidectomy patient. What does this indicate? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hyponatremia. Answer. B. Hypocalcemia. Question 32. A nurse is reviewing lab results of a patient with diabetic ketoacidosis, DKA. Which value is expected? A. Serum glucose 90 mg per deciliter. B. pH 7.35. C. Serum potassium 5.8 milliequivalent/L. D. Bicarbonate 26 milliequivalent/L. Answer. C. Serum potassium 5.8 milliequivalent/L. Question 33. The nurse is caring for a client with SIADH. Which order should the nurse question? A. Restrict fluids to 800 milliliters per day. B. Administer 3% hypertonic saline. C. Give vasopressin. D. Monitor serum sodium. Answer. C. Give vasopressin. Question 34. Which gland secretes melatonin to help regulate sleep-wake cycles? A. Hypothalamus. B. Pituitary. C. Pineal. D. Thalamus. Answer. C. Pineal. Question 35. What does the hormone prolactin do in the female body? A. Stimulate ovulation. B. Regulate fluid balance. C. Initiate milk production. D. Control sleep cycles. Answer. C. Initiate milk production. Question 36. Which hormone regulates the body's metabolism? A. Parathyroid hormone. B. Thyroid hormone. C. Calcitonin. D. Insulin. Answer. B. Thyroid hormone. Question 37. Which lab value supports a diagnosis of hypothyroidism? A. TSH 7.1 IU/ml. B. TSH 1.2 IU/ml. C. T3 180 ing/dl. D. Free T4 1.4 ing/dl. Answer. A. TSH 7.1 IU/ml. Question 38. A patient with diabetes is scheduled for surgery. Which pre-op glucose level would require action? A. 98 mg per deciliter. B. 130 mg per deciliter. C. 220 mg per deciliter. D. 160 mg per deciliter. Answer. C. 220 mg per deciliter. Question 39. Which assessment finding indicates that desmopressin therapy for diabetes insipidus is effective? A. Decreased urine-specific gravity. B. Increased thirst. C. Normal serum sodium level. D. Polyuria. Answer. C. Normal serum sodium level. Question 40. The nurse is teaching a patient with hyperthyroidism about nutrition. Which food should the patient avoid? A. Baked chicken. B. Iodized salt. C. Applesauce. D. White bread. Answer. B. Iodized salt. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.